Hello everyone, we're going to talk today about my favorite topic, which is root resorption. Why is my favorite topic? I did a PhD in craniofacial molecular biology, and during the PhD, the only reason why I wanted to go to the PhD is because the National Institute of Health allowed me. It was actually the National Institute of Craniofacial Molecular Biology in Washington allowed me to have a grant to study root resorption. And what is root resorption? Is the destruction of the calcified tissues of the tooth, meaning we have in this area hydroxyapatite, and this part of the enamel is hydroxyapatite. This is the crown, this is the root, this is the crown of your tooth, and this is the root. This tooth that the patient had a big trauma. He broke the tooth, and they have to make it like a braces to make it stable. However, the root was eating itself. How was eating itself? I don't know how much this image can show you, how much the image can tell you, but in this image you can see that when we have the bone here, the cells start becoming from a regular nucleus to multinucleated and then become osteoclast. And once it's an osteoclast, they start releasing an enzyme around the root, and these enzymes are going to dissolve the hydroxyapatite of the tooth. For that, the root has to be denuded, meaning the cementoblasts, that are the cells around the root of the tooth that are covering the tooth, are not going to be present. And then the root start destroying little by little until they become this part you're gonna see in this tooth. This is the big part of the destruction of this tooth. And look at this area. This is a black area here. That is the root resorption of the tooth. The mother was devastated because this tooth has mobility, and the amount of resorption, all of this was gone of the tooth, all this part of the root, and everybody wanted to extract the tooth. When the patient came with me and asked me, I started thinking molecular pathways of the tooth. I learned recently with Dr. Ramon Payne about microtubules that are inside of the cell, and they are like transcription factors that start giving instructions about how the cells have to move, how the cells have to operate. And that gave me a more incentive to think this is why resorption is working with our treatments. We use a material is called mineral trioxide to seal the denuded area of the root, and in this part we place the MTA, but the MTA needs to have on top of it Gerastor, which is a resin that it will be become like a mash together with the dentin and the soft tissues and the bone of the tooth, and it's going to be like a wall, and it's going to avoid the tooth continued destruction. Actually, it's going to stimulate root formation, bone formation, and not only that, this is MTA, not only that, the patient will not lose the tooth. And at least this patient, that is an extremely young patient, is 12 years old, is gonna keep the tooth until he's able to have an implant. Most likely the tooth, this kid is a sport kid that he plays soccer, he loves soccer, and I advise him to wear a night guard all the time. He's about to come again. I talked to the mom, the patient is doing well. So what we developed a treatment for this patient was very not simple. Like Dr. Payne said, I make it look simple, some of the situations that he tells me, but it's not that simple. I'm gonna make big this image. If you look at this area, we close this area with a Gerastor. Actually, Dr. Bijak was with me with this surgery. He is at the office, and he was able to help me during the surgery together to achieve a great anatomy, in this case, to have the patient shape like a figure of the root in this area. So why do we have to do surgically? Because when we work with MTA it works amazing for root resorption. And what does MTA do? It induces the formation and also it delivers calcitonin, and calcitonin paralyzes the osteoclast. And when the osteoclast is paralyzed, there's nothing they can do to continue dissolving or eating the tooth. So now we have restored these 3 teeth that have also resorption in the similar extension, and the patient is happy. It's important when the endodontists do the isolation of this, because we don't want any bacteria inside. I didn't put the clamp that we placed to support the rubber dam was placed in a tooth next to it, and this one was next to it, and then we put a barrier of all this material that is amazing to isolate the tooth. We placed the MTA. This picture is when we were placing the MTA. Then after the MTA is placed, I make the patient come back in a week. We did the surgery to cover the external area of this. Is the only tooth that has to be covered surgically, because the others didn't need to have that. The mother is very happy, the patient is very happy, and we can count that this kid is gonna have these teeth probably for 10, 15 years more. I'm gonna see them every year. And this treatment was finished in October of 2023. I just received information that the kid is doing well. I haven't get the x-ray from the mom. I told her to get a dentist to get an x-ray. But what is the message that I wanted to give you in this presentation? Root resorption is treatable. So if you hear root resorption, they can extract your tooth, you send me a text, try to find me on a website, or send me a text in YouTube. I will be happy to talk to your dentist, or you can send me a message on Instagram. Thank you, and I hope you like and you have learned something about keeping your teeth is the best that you can do. Also keep your brushing and flossing at night. Thank you and have a great day.